Hello ladies and gentlemen, welcome to Visa Pathfinders. We are here to make your migration dream a possibility by providing you with relevant information, other infotainment and updates across Europe, United Kingdom, United States of America, Canada, Australia, New Zealand, Asia, among others. Kindly like and share our videos. Subscribe to this channel and hit the all-important notification button, so that you don't miss out on any of our new videos. And to all our incredible followers and subscribers, we say thank you so much for being there always. Today we are discussing the spectacular news from Canada with the new Canada Permanent Residency PR Express entry targeting healthcare occupations in 2024. Canada desperately needs additional healthcare workers to work in Canada. The Express Entry healthcare draws were introduced in 2023 as one of the levers at the disposal of the Government of Canada to attract and retain these badly needed healthcare workers. Express Entry, as the name implies, fast-tracks immigration applications. Canada's Immigration Department, Immigration, Refugees, and Citizenship Canada (IRCC) aims to process the majority of applications within 6 months. Meaning it is expected that all the processing should be completed within 6 months. That is from application to the approval of permanent residency to move to Canada. Though this is not definite. Why move to Canada as a healthcare worker? Every year, healthcare workers from around the globe choose Canada for its high quality of life, overall safety, and welcoming environment for people of all backgrounds. Canada is world-renowned for its healthcare system, which makes it an ideal place for healthcare professionals to launch their careers. Labor market insights for healthcare workers reveal the scope of labor shortages and worker prospects across Canada. Canada is constantly recruiting healthcare professionals, as the sector is vulnerable to labor shortages. It is estimated that about 500,000 healthcare workers in Canada will retire within the next decade. Meanwhile, the national population is increasing. Put these trends together, and it's clear why Canada is looking abroad for healthcare workers of all kinds. Immigrants generally account for 1 out of every 4 healthcare sector workers in Canada. This share is set to increase over time. Canada's labor shortages could be your opportunity. Express Entry healthcare draws prioritize healthcare workers for permanent residency, which comes with the right to live anywhere in Canada and not be tied to any specific employer. Accompanying family members can also settle in Canada with a principal applicant. So, how can you take advantage of Express Entry healthcare draws? Let's put you through.
Which healthcare occupations are targeted by Canada in this special draws? To be eligible for this special healthcare occupation draws, you must be working or have experience in the following occupations. They include general practitioners and family physicians, nurses, medical laboratory technologists, medical radiation technologists, medical sonographers, caregivers, and care assistants, licensed practical nurses, nurse aides, orderlies, and patient service associates, audiologists and speech-language pathologists, chiropractors, dentists, dietitians and nutritionists, educational counselors, kinesiologists, and other professional occupation in therapy and assessment, massage therapists, medical laboratory assistants and related technical occupations, occupational therapists, optometrists, pharmacy, technical assistants and pharmacy assistants, physician assistants, midwives and allied health professionals, physiotherapists, psychologists, respiratory therapists, clinical perfusionists and cardiopulmonary technologists, veterinarians, among others. Ensure you identify the regulatory requirements for your profession if regulated in Canada. How to become eligible for Express Entry healthcare draws. Before you can be eligible for healthcare draws, you need to be eligible for an Express Entry managed program. Express Entry is an immigration application management system that uses an expression of interest intake model for various Canadian immigration programs.
To immigrate, you must submit your profile to the pool of candidates so that Canada knows you want to immigrate. Then, Canada invites you to apply for permanent residency if you meet certain conditions, including a points total based on various factors. IRCC will only accept your profile into the express entry pool. If you are eligible for one of the following immigration programs: Federal Skilled Worker FSW, Canadian Experience Class C, and Federal Skilled Trades FST. From there, based on the documents and information you send showcasing your work experience, education, age, and official language ability, you will receive a score on the Comprehensive Ranking Score (CRS). Your CRS score is an important factor as to whether you receive an ITA in a round of invitations, also known as a draw. When IRCC holds an express entry draw, it issues invitations to the highest scoring candidates. In an all-program draw, IRCC only invites the top-scoring candidates in the pool. In a category-based draw, IRCC invites the top-scoring candidates who may meet the eligibility criteria of the draws. Category: Healthcare Express entry draws are category-based draws. To be eligible for the health worker category, you need at least 6 months of full-time work experience in an eligible occupation within the past 3 years, as compared to the General All-Program draw where the average score invited for ITA for permanent residency application has been between 535 to 560 in the last 6 draws or within the last 6 months. The Healthcare Express entry draws has been averaging for 120 to 430 within the same period, being more than 100 points less than the general draw score, which makes your chances higher to be nominated.
The Comprehensive Ranking System's CRS points are awarded differently, depending on whether the applicant is married or single. To qualify as soon as possible for this targeted draw, ensure you target maximum score in the below. For core or human capital factors, for someone with a spouse or common law partner age, level of education, language proficiency, and work experience will fetch you 100, 140, 150 and 70 points respectively, giving a total point haul of 460, while for someone without a spouse or common law partner age, level of education, language proficiency, and work experience will fetch you 110, 150, 160 and 80 points respectively, giving a total point haul of 500. Spouse or common law partner factors give a total of 40 points, being 10, 20 and 10 maximum points for level of education, language proficiency, and work experience. Skill transferability factors give a maximum of 100 points, with 50 points each for education and work experience. So, folks, get down to work and be on the move to Canada as soon as possible. And that brings us to the end of today's video regarding the spectacular news from Canada with the new Canada Permanent Residency PR Express entry targeting healthcare occupations in 2024. If you found this information valuable and you're eager for more most updated information and immigration tips to successfully migrate, then kindly like and share our videos and subscribe to this channel. Then don't forget to hit the notification button to have all our latest videos produced. If you need help, however, with specifics or individualized services in particular, please feel free to contact us at visapathfinders@gmail.com, and let's create this success story together. Thank you and see you at the next video.